Yeah, Johnson, YouTube live is fine actually. It's on live now. You're fine. But let us see whether it's moving on after starting our session. It gets recorded as well now.
Yes, sir. It will be recorded.
YouTube live is fine. It's on live now. But let us see whether it's moving on after starting our session. Hi Johnson, are we reached 500?
Yes, sir. 500 we reached.
Oh, that's great. And dear participants, if somebody is unable to enter into Zoom, let them be join with our YouTube live, because already it's start living on through our Luth Education Academy live stream. Please kindly intimate to your friends. If anybody is on waiting room, Mr. Johnson.
Yes, sir. Around 200 people are there in the waiting room.
Waiting room. Okay. Then, if you don't mind, dear students of Lourdes College of Nursing, would you please kindly please get out from our Zoom and please join with our YouTube, if you don't mind. Already YouTube live is on. And you guys, just participants, please relax and attend, because the same session might be reloaded in YouTube also in our Lourdes Education Academy channel. And the third year and fourth year students of Lourdes College of Nursing, please kindly exit from Zoom and please join with YouTube live, please. Because we would like to give an opportunity for the outsiders to come in Zoom, because many of them are trying to register and come in through Zoom, please. Dear third year and fourth year students of Lourdes College of Nursing, please exit from Zoom and kindly join with YouTube live, please. Johnson, once these people are going out, please admit the outsiders inside, okay?
Yes, sir. They started leaving one by one, and I admitted.
Yeah, that's great. And all the participants, kindly ensure you are always mute, because your house and your baby's background noises are always coming in during the session. So every one of you, please kindly make an attention that your mic is muted all the time during the session. And all the participants are encouraged to make questions at the end of the session, or you can put questions into the chat box nearing ending to the session, please. For attendance purpose, the third year and fourth year students of Lourdes, please kindly put your name and year into the chat boxes of YouTube live stream, please. Johnson, mute them, all of them. Surya, did you join? Surya, are you
Yes, sir.
inside?
Yes,
You are
sir.
ready. You are ready,
Yes,
isn't
sir.
it? All
Yes,
right,
sir.
fine, fine. We'll wait for 5 more minutes. Okay.
Okay, sir.
Dear participants, we are already filled our Zoom room. And if any of your friends are trying, please ask them to not to come into through Zoom. Ask them to please join with our YouTube live, please. The live stream will be assisted through login to Lourdes Education Academy live streaming. They can put it, type as an Lourdes Education Academy into the search box of the YouTube. Immediately the live stream will be displayed onto as a first program into our channel. Mr. Johnson, shall we start? I think we'll take 5 minutes to complete our formalities. And shall we start? Surya, are you ready?
Yes, sir.
Johnson, shall we start? If anything else?
Yes, sir. We can
Participants
start.
participants are already here. Around 700 people are here already. Okay. How many are in the waiting room still, Johnson?
Waiting room around 20 members.
20 members only. That's fine. Okay. Probably then coming to through. Maybe we'll wait for their keep joining right now with YouTube. The number is going up. We don't have any options to instruct the waiting room people to go out and join in YouTube. Just a minute. It's moving on. Johnson, let us start. Okay, please. Okay.
Yes.
Surya, please start.
Good morning, one and all. A warm welcome to all of you for our second day of state level webinar, Growth and Development, a Progressive Advancement of Little Lives, organized by Lourdes College of Nursing, Taliparamba, Kannur, in association with SNA North Zone. It's my pleasure to welcome our principal, Professor Sendil Kumar T, our well-acclaimed speaker, Professor Dr. Nandini M. Ma'am, you have a bucket of warm welcome and regards from our dear director, Ms. Raghi Joseph. Due to some inconvenience, she could not join for this occasion.
Thank you.
And our vice principal and advisor, North Zone SNA, Mr. Johnson LK, invited delegates, my dear colleagues and students. It's great joy in welcoming all delegates attending webinar series through Zoom and YouTube live stream. Let us start with second day session on growth and development of toddler. Biologically, child is a human being between the stages of birth and puberty, or between the developmental period of infancy and puberty. Children become the happiness of the society and home, as well as the future of the country. Learning about growth and development of children help us to understand normal growth and development and helps to make difference in children who are coming to us. Physical growth is an increase in size. Development is growth in function and capability. Both processes highly depend on genetic, nutritional, and environmental factors. As children develop physiologically and emotionally, it is useful to define certain age-based groups. Today also, we have eminent personality and child health specialist as a resource person. With immense pleasure, let me introduce our resource person, Professor Dr. Nandini M., who will speak on about growth and development in toddler. She is currently working as a Vice Principal of Ashwini College of Nursing, Thrissur. She completed her undergraduation from PSG College of Nursing, post-graduation in Child Health Nursing from KMCH College of Nursing under Dr. MCR Medical University, Coimbatore. She has been awarded PhD in Nursing under MG University, Kottayam. She has an additional qualification in MA Sociology from Annamalai University. She has 19 years of professional experience in clinical, teaching, administration, and research. She has published in 17 international, 19 national journals, and has 10 conference presentations. Also, she has organized regional and state level workshops and conferences. She is an examiner for undergraduate and postgraduate students, inspector and board of study member under Kerala University of Health Science. She guided many UG and PG students under Kerala University of Health Sciences. She is the scientific committee and editorial board member, also a book reviewer in various journals. Her area of interest is orofacial clefts, and she has the recipient of Cleft Child International Scholarship Switzerland in 2012. With great pride and honor, let me invite Professor Dr. Nandini M. take over the session. Over to you, ma'am.
Thank you, Mrs. Surya, for your kind introduction about me. So, esteemed delegates from academic fraternity and student community, a pleasant morning to all of you. First of all, a warm greetings from the management, principal, and students of Ashwini College of Nursing, Thrissur. At the outset, I would like to thank to the management, especially Mrs. Rakhi Joseph, Director of Lourdes Education Academy, Professor Sendil Kumar T, Principal, Lourdes College of Nursing, Kannur, Taliparam, and to all the organizers for inviting me as a resource person on this webinar series on progressive advancement of little lives. I am pleased to be a part of this 5-day mega webinar series, and congrats to the organizing members for bringing up a new concept on growth and development as well. Let me also take this opportunity to extend my heartfelt gratitude to my principal, Dr. Lieutenant Colonel Rosie K.O., the principal of Ashwini College of Nursing, for granting me the permission to deliberate a session on today. So, dear delegates, I am sure till today you all are in the stage of infancy. Since it is a 5-day mega webinar series, yesterday you have come across the G&D of infant. So till today you are in the stage of infancy, and hope you all are getting ready to undergo the process of the progressive development of the next stage. Are you ready? So shall we start with the next stage of the growth and development, that is toddler. So I'll start to share the screen. So is it visible? Hello?
Yes,
Yeah,
ma'am.
it's fine. Yeah, it's fine. Yeah.
Okay. Thank you. So once again, a warm welcome to all the delegates of today's webinar to the progressive development of growth and development of toddler. So no need to explain this aspect again. Yesterday we have seen that all these aspects. But in nutshell, I could say that growth is nothing but it is a physical change or qualitative change, whereas development is a qualitative change and growth is a quantitative change, where the development happens till death and growth stops at particular stage or at the age of maturity. So now let us see a verbatim of a very stressed out mummy. I am at my wit's end and really need some advice. My little boy is almost 3. He does not listen to anything we tell him. He is so headstrong and does his own thing all the time. Today, for example, we were out shopping and he started climbing up railings. When my husband took him down, he started making a scene saying that his daddy is hurting him. Definitely didn't. Bedtime is awful. So mother is posing a question or mother is in dilemma. Is this a phase? She is also posing a question to the counselor that has anyone else gone through anything similar? So this is a typical character of a confounding, challenging creature, that is the toddler, and to the parents who really struggles to understand them. So let us see who is this toddler, or they are otherwise called as terrible twos. The child between the age of 1 to 3 years or period from 12 to 36 months of age are called toddlers. And what are the general characteristics of the toddler? We know that from the infancy, during the infancy stage, the child was totally depending for all her activities, including grooming, feeding, toileting, for everything she was depending on to her mother. So during the toddler, they enter into the stage of independence. And another important specific characteristics is that it is a stage of intense exploration and investigation of a world beyond the parents' arms. They are looking forward to get independence and they are looking forward to get the autonomy. And because of the increased fine motor and gross motor activities, they start to explore their environment. Always, all the time, they want to play. Play is the only work of the child, especially only work of the toddler, and they enjoy the playtime. Due to increased locomotive or heightened locomotive activities or heightened curiosity, they are more susceptible victims to trauma and injuries. Toddlers are highly receptive, understands and implements the parental suggestions. So let us have a look on to the classification of the toddler. There are two types of toddler, mobile young toddler and older active toddlers. Mobile young toddlers come in the age group of 13 months to 23 months, that is from between 1 year to 2 years. Of course, they are curious and more energetic. Even though the language is not developed properly, they start to do the babbling. For example, babbling in the sense they may say tata, bye-bye and all. Judgment is purely based on perception rather than logic, and for this they are intensively using all their sense organs. recognize the parents and special people, and they are having attachment to the special toys, or they are very specific to the nature of the physical objects. And we could see here is that during this age group, the toddlers are having separation anxiety, especially during hospitalization, or if the mother is a working mother, there also we can recognize this separation anxiety. Of course, the child could express the feelings through crying, facial expressions, or body language. I mean, in the form of temper tantrum, they will express all their frustrations. They can understand the words, but due to the poor development of the language in the early toddler, they communicate by making sounds or by making actions. If we ask the child, "Do you like this food?" they may close their eyes or they may simply shrug their shoulder. Sometimes they may not be able to talk clearly. Then older active toddlers between the age of 2 to 3 years, they are highly self-absorbed and egocentric. Egocentric, you might have heard about this word. Many times we used to say to the adult that he is a bit egoistic. But here egocentrism, it is being described by the Jean Piaget. He says that it doesn't mean that child is selfish or egoic or self-centered. It is the inability to take the perspective of the another person. The child is not able to understand the feelings of the other person. For every time he thinks that I am the only one person in this world. Then coming on to the physical activity, they are completely working on to the physical skills, always running, jumping, climbing, riding the bicycles. They won't sit in a place for 5 minutes. And within 1 minute, they will do lot of within a 1 minute of unsupervised time, they will do lot of activities. Rapidly learning words is happening between the later half of the toddlerhood. Sense of self, everything towards to me, a sense of egoism or self-centered behavior they are developing, and they knows the meaning of me or my or mine. Everything they will say, ellam eniki ennulla oru word aayirikkum, it will be coming from their mind. Empathetic if others are hurt, especially if the mother is hurt, they may ask, what happened to you? What happened to you? But they don't know what is the cause and effect of that hurt. Simply they may ask, what happened to you? So this is the classification. And next comes to the body proportions of a toddler. You see the child, the chubby appearance of infancy is lost due to the development of the muscles, protruded abdomen, and this protruded abdomen makes the child a pot-bellied. So this pot-bellied is due to the poor development of the abdominal muscles, slightly bowed leg and flat feet. So bowed leg is nothing but when the child assumes a standing position, there exists a gap between the knees. So this is normal in case of toddler. But if this bow leg is persisting beyond the age of preschool, it needs to be notified, because the bow leg is one of the typical characteristics of a vitamin D deficiency disorder called as rickets. Many times the parents may have confusion in their mind whether it is normal or abnormal. So till 3 years it is normal. Slowly the child may able to come into the normal posture. But provided during the toddler time, the mother has to ensure that the child is getting adequate source of vitamin D, especially through milk and other supplements. The flat feet, you can see the picture of a flat feet. It is nothing but the sole is totally pressed against to the floor, and the absence of arch you could see over here. And this absence of arch is due to the fat pad is totally covering the arch. Gradually, the arch may develop in the preschool years. So while plotting the growth, while plotting in the growth chart, while plotting the height and weight in the growth chart, you may get a curved, straightened infantile curve. Legs are relatively short, and due to that, the toddler may have toddling gait. Toddling gait in the sense it is a short step. At the same time, the gait will be unsteady. Many times there is a chance for the child to fall while walking or while running. So certain physical or biological growth development, that is especially the anthropometric measurement. So height and weight, the important indicators for the anthropometric measurement. And here you could see that related to the weight, the toddler gains 1.8 to 2.7 kg a year per year. We know that the birth of a normal newborn weight is 2.5 to 3.5 kg, and it gets doubled by 6 months, triples by 1 year, and the expected weight of a 1-year-old child is 10 kg. So at the age of 2 years, the expected weight is 12 kg. But the typical feature of the toddler in relation to weight is that the toddler's rate of weight gain declines markedly when comparing to the infant. And another characteristics is that even though the weight gain of 1.8 to 2.7 kg happens, the gain occurs in a stepwise or short spurts rather than in a uniform over the months. And by 2.5 years, the birth weight quadruples. There is a formula to calculate the weight of a toddler. I mean, this formula is for child between 1 to 6 years, age in years into 2 plus 8. The height is the another important parameter in the anthropometric measurement, and the height is greater than the weight during the toddler years. Height increases by 10 to 12.5 centimeter per year, and once the child reaches 1 year, the expected height is 75 centimeter, and by 2 year expected height is about 85 centimeter. Generally, boys are taller than that of the girls. The formula to calculate the height is age in year into 6 plus 77. The next important determinant is in the anthropometric measurement is the head circumference. So the head circumference indicates the development of the head, or expanding head size reflects the growth and differentiation of the nervous system and development of the intracranial volume. The normal head circumference of a newborn is 33 to 35 centimeter, and by child reaches 3 years, the head circumference will be 50 centimeter. Of course, the head circumference is greater than that of chest circumference till 1 year, and HC will be equal to CC at the age of 1 year, and HC will be greater than that of CC after 1 year, because the anterior posterior diameter of the chest is increasing, and that causes the head circumference greater than that of the chest circumference. Another typical feature in the head we have to note down here is that anterior fontanelle closes between 18 months, that is 1.5 years. So this plays an important clinical significance while taking care of a child with hydrocephalus, meningitis, or with severe dehydration. In severe dehydration, we could see a depressed anterior fontanelle, whereas in increased ICP, as in the case of meningitis and hydrocephalus, we could see a bulged and pulsatile fontanelle or glistening fontanelle. So this needs to be notified while doing the physical examination or GNT of a toddler. Chest circumference, already we have discussed, the continues to increase in size and exceeds the head circumference during the toddler year. The anterior posterior diameter will be increasing, and after 2 years, the chest exceeds the abdominal measurement. Mid-arm circumference or mid-upper arm circumference. This is another new important parameter which you have to add up in the toddler stage along with the head and CC, head circumference and CC. So mid-arm circumference indicates the muscle development or muscle wasting, and it correlates with the clinical sign of malnutrition. So it is mandatory to do the mid-arm circumference between the age of 1 to 5 years, because during this age only the children are more prone to develop undernutrition or malnutrition. So this is the measurement tape, otherwise called as Shakir tape, and it is an efficient technique for screening the large population of the children. You could see the 3 different colors. The green indicates normal, that is more than 14 centimeter. and yellow indicates 12.5 to 14 centimeter, that is mild malnutrition or moderate wasting only has happened, and less than 12.5 centimeter indicates severe wasting. So if you come across any toddler even by taking an inch tape also, you can assess the mid-arm circumference. So once the child reaches to the age of toddler, so between the age of 1 to 5 years, the normal mid-arm circumference is 16 to 17. If it is below that, you have to give the nutritional counseling or the appropriate intervention needs to be taken. So this is the growth chart, the WHO growth chart, especially the WHO growth chart is separately maintaining even for the boys and the girls. And here we could see that the growth and the weight and the height is plotted in the growth chart. So accurate measurement of the height and weight during toddler year shows a steady growth curve that is step-like in nature rather than the linear. So onto the top, you can see that this is the good indicator of the growth chart, and this is dangerous and this is very dangerous. So we could see that the green indicates the normal, that is an upward movement or the growth chart. This is called as infantile curve. The curve is maintained in the growth chart, which indicates the child is normally nourished. Then another important part of dentition. So the first eruption of the teeth happens at 6 months, and that is the central incisor. And in toddler, the molar teeth, canine teeth, and second molar teeth is erupting. So at the age of 2.5 years, there are 20 temporary teeth, and there is a simple formula to calculate the number of teeth for a toddler till 2 years, that is age in month minus 16. But it may vary because the teeth eruption, it is not necessary to develop the teeth in the correct stage, because age of tooth eruption shows considerable variations, but the order of the appearance is fairly regular and predictable. So in that case, this formula may not be applicable. So this is a temporary teeth chart. You can see the age group, name of the teeth, when it erupts and when the shedding is happening, going to the permanent teeth. So with related to the system-wise development, the integumentary system, the resistance of the skin to infection and its ability to prevent the fluid loss is increased. Mainly the toddlers may have dry skin due to inadequate sebum productions. The sweat glands produce a small amount of sweat. And in relation to cardiovascular system, the pulse rate decreases and the blood pressure increases with a range of 70 to 110 beats per minute and BP of 100 to 60 mm of Hg. In relation to respiratory system, the structure of the respiratory system increases in size with accompanying in thoracic volume. The internal structure of the throat and ear is short and straight, and this makes the child more prone to get severe respiratory tract infection than otitis media, tonsillitis. And respiratory rate comes to the rate of 30 breaths per minute. The gastrointestinal system, salivary glands has reached to functional maturity. Very well, the toddler can chew food and keep it in the mouth. The salivary enzymes act upon it. So here the mother has to keenly observe whether the child is chewing the food properly or not. Sometimes even some kids, they may swallow the food and it can cause some aspiration or choking. Capacity of the stomach increases. The toddler could able to tolerate 3 meals per day and a night bottle feeding or a cup of milk. Hydrochloric acid secretion is increased, which gives protection against the several types of organism, and the toddler age are less prone to get infectious diarrhea than that of an infancy. Related to immunity, the passive immunity received from the mother decreases during the infancy. So immunization is very essential. Of course, the IgM has reached to the adult level during infancy. IgG reached by 2 years, but still IgA, IgD and IgE is not reaching adult level until later childhood. The excretory system, with the continuing maturation of the kidney, physiologically conserve the water and they could able to concentrate the urine on a level similar to that of an adult. Improved bladder capacity for 2 hours. Daytime control can happen between 2.5 to 3 years. Fairly good bowel and bladder control by 3 years. And this is the age the child has to undergo toilet training or potty training. Another important system in relation to the motor development and cognitive development is the nervous system. 75% of the brain growth is completed by the end of 2 years. The number of the brain cells complete by the beginning of the toddler period. And here we all know that during the toddler period only the vocabulary is increasing or the language development is happening. This is due to the development of the Broca's area for the speech and cortical area for the motor control of extremities and sphincters undergo specific changes. And this increased maturation of the brain together with opportunities to explore the world contributes to the toddler's emerging intellectual or cognitive development. So I could say that there is a good chemistry is happening between the maturation of the brain and exploring the environment towards to the development of the cognitive development. Toddler can handle only one incoming stimuli at a time. For example, if the mother has scolded the child for grasping a breakable object in his hand, the child may not be able to respond immediately if a second admonition is also given. That means the child is not able to cry immediately because the mother may repeatedly keep on scolding the child, and mother even may give a second warning also. By the time a late response is happening for the first stimuli. Then sensory system, visual acuity is 20/40. Full binocular vision is well established, which was lacking in infancy. So what is this binocular vision? It is nothing but the child could able to see the objects in single vision with both eyes. So, but if the binocular is not well established, we have to suspect for the strabismus or crossed eye, and it needs early intervention. Depth perception continues to develop. So depth perception, again, it's nothing but seeing the object in 3 dimensions in terms of length, height, and width. Since child completely depth perception, it's not happening. They are in the process of continuation. So due to the lack of the depth perception during the toddler age, many times they used to fall from the height. You might have observed the faculty members who are happening in their home, you might have observed that many times when they climb on the upstairs and even they may jump on the bed. So they don't know the exact nature of the height of that jump, height of the bed and the floor. So many times there is a chance for them to fall. So this fall is due to the lack of depth perception. Then all the sense organs are intensively explored by the toddler for exploring their environment, hearing, smell, taste, and touch. If citing for an example, if you give a new food item in their hand, the child will take that food item, she will turn that food item, she will smell it, and she will touch it, whether it is hard or smooth. She may take it towards to the nose and smell it, whether what is the order. And after exploring all these things only, if she is satisfied with that thing only, the child may take that food. So intense exploration, and to some extent we could see that the child not only use the senses but coordinate them with other learning experience. Even they may shake and see whether it is making any sound or not. And so that is the intense exploration. Increasingly able to remember the source of pain. This is a very typical characteristics in relation to the touch. So the parents and the pediatric nurse and the student nurse who are working in the pediatric unit needs to be very cautious while if the toddler is undergoing any invasive procedure, we have to ensure that it is not causing any bitter experience or traumatic experience to the child. because all the time they will remember the source of the pain. So that is the reason whenever they enter into the hospital or whenever they passes the immunization room, the child started to scream and child started to cry like anything. Then, so that's all related to the system-wise development. And coming to the core part of the toddler, this is the main area of the toddler, gross motor development. So this gross motor development is nothing but the child is using the large muscles for the locomotive actions. And the major gross motor skill during the toddler year is development of locomotion. So here for your easy understanding, it is divided into 4 months, 15 month, 1 year, 1 year, 3 months, 1.5 year, 2 year, and 30 months. So you could see that in 15 months, they could walk without help. And in 1.5 year, they walk sideways and backwards. And 24 months, they can walk with heel to gait. And 30 months, they walk upward and downward. So 15-month child cannot throw the ball without falling. They may try to keep the ball in their hand, but many times it may fall on the floor. But gradually he could able to throw the ball overhead without falling in 1.5 year. And with the kicks the large ball without falling gradually as the age advances, and jumps well in place with both feet of the floor in the later half of the toddler. Fine motor development, where the child is using it is the acquisition of the motor dexterity or skillful manual dexterity is called as fine motor development. With the help of the crude pincer grasp and the palmar grasp, the child is able to maintain the fine motor development. So some scribbles are seeing in the screen. I don't know why it has happened. Is it visible? Whether the slides is visible?
Yes, ma'am, it is visible.
Yeah, okay.
Yes, madam, it's visible.
Okay, thank you. So here you could see the fine motor development, built a tower of 2 to 3 cubes in 15 months, and by 1.5 year, they could able to build a tower of 3 to 4 cubes, and it is increased to 6 to 7 cubes, and at the age of 30 months, they could able to build a tower of 8 cubes. So while seeing all this fine motor development, you can understand that how finely the fine motor development is gradually developing by the child crosses all the ages. Then a small child is able to insert a pellet in a narrow-necked bottle. They could able to transfer the objects hand to hand. Then even if we give a bottle in their hand, a 2-year-old child could able to unscrew the lid, and even they could able to turn the door. But while giving a paper or the book in their hand, they turn the pages of book one at a time. Then by using the crayons, they can scribble in the papers, but picture formation, it's not happening really. And this is a sequential development in self-taught art by a toddler. So early toddler, you just see it is only a basic scribbles. Slowly the pattern is forming, and between the toddler age, I mean the later half of the toddler, a diagram is started to develop and combinations, and they could able to aggregate. So this is the time the child used to scribble everywhere, especially onto the walls and all. Many times the parents are bit showing frustrated behavior towards to this behavior. So never ever show that aggressive behavior towards to the child. You can, instead of that, you can give a paper or pen or pencil or even a blackboard to draw the art and encourage the child to go for the art. So self-care skill development. So the main self-care skill are feeding skill, dressing skill, toileting, and grooming skill. So coming to the feeding skill of a 15-month-old child, holds a cup. In relation to the feeding skill, this is the very emerging concern for the mother, because this is the time where the child has
Participants, please don't scribble on the slides, please. Somebody is scribbling onto the slides. Mr. Johnson, please identify the person and try to remove him.
Yes, yes.
No, I do also find difficulty to read the slide, to see the slides. That's why I just asked in between.
No, just a minute. We are trying to take steps. Somebody is just scribbling on the screen, and we are recording all the events, and we would able to identify the person. Dear participant, kindly ensure you are making utmost etiquette in attending the webinar. Johnson, try to move on to the.
Yes, sir.
See, for me, it is nothing is visible in the screen.
Yeah, it is for everyone. It is for everyone. The problem is we are trying to rectify the problem. Someone is meticulously doing some scribbling onto the screen, but we are trying to track out. And the entire session is recording, and we would able to track it out the person also. And let us see. Participants, please kindly maintain the discipline while attending the webinar, please. And switch over to the next slide, please.
See, totally it is like that way.
Oh, yeah. Just hold on. Sorry for the inconvenience. Just hold on.
No problem.
We are trying to make some steps.
ഇപ്പൊ കറക്റ്റായി ഇപ്പൊ കറക്റ്റാ.
You can start doing it. Fine. Everything is fine now. And the participants, please kindly maintain the discipline while the presentation is going on, please. Thank you. And the entire session is recording, and like any mischievous can be identified very easily, and we may even move on to the legal action. Thank you. Please extend your good cooperation. Thank you. Please continue.
Yeah. So to continue with the self skills, the feeding skills, dressing and toileting and grooming skills. So the related to feeding skill, the mother find very difficulty to wean off from the bottle to the cup and spoon. And dressing skill, due to the increased independence, the child start to remove simple garments like shoes and unzip their garments. And in relation to toileting and grooming skill, due to the bowel and bladder control attainment or sphincter control, the child would able to indicate when diaper is wet or soiled. And later on to the later half of the toddler, they begins nighttime bladder control as well. Then the next very important developmental for the stage is psychosocial development. According this theory was coined by Erik Erikson. The stage the toddler has to undergo is autonomy versus shame and doubt. The simple meaning of autonomy is independence, whereas shame and doubt is the unpleasant feeling of the guilt. So what is happening to this psychosocial development, or how the child attains the autonomy? So as the child gains control over eliminating function and motor ability, they begin to explore their environment. So the main three tasks attaining by the child, toddler, during this psychosocial development is gaining self-control, developing autonomy, and increasing independence. So in order to succeed the developing autonomy, it is the responsibility of the parents to provide a strong base of security from which the child can come out with that activities. The parents' patience, encouragement, love, affectionate care, everything fosters the autonomy in the child. You know that a toddler will keep on move here and there. ഒരു സ്ഥലത്തും they won't, ഒരു സ്ഥലത്തും they won't sit and keep quiet. So whatever it is coming in their side, they will explore. If they see a matchbox or if they see a lamp, they want to touch and see how it feels. So everything they will explore. But here, the role of the parent is that not to restrict the child and not to scold the child, but at the same time, under the supervision, she has to provide a base of security. And another important area in relation to toilet training, so psychosocial development is a bit related to toilet training as well. The child started to develop the bowel and bladder control, and sometimes they may feed themselves, they may wash and they may dress themselves, and they may use the bathroom. So everything is their independent activity. So during the time, encourage the child to do these activities. And instead of that, if the caregiver is demanding too much and refusing the child to perform the task, they may develop the doubt inside their mind. Am I not possible to do all this activity? Or why my mother is keep on scolding me? Am I not having the independency? Or am I not having the ability to do the activities? So that may result in shame and doubt. And gradually, this type of children develops the lack of self-confidence, lack of self-esteem in the later half of the years. The psychosexual stage, according to Sigmund Freud, this is the anal stage. According to him, from birth onwards, an innate tendency to seek pleasure is happening by stimulating the different parts of the zones. And this zone is called as erogenous zones. So the region around the anus become highly sensitive to the stimulation of holding on and letting go. The child obtained pleasure from the feeling of a distended bladder, from masses of feces in the rectum, and from release of content of this organ. So two stages of pleasure is happening over here. Pleasure from expulsion and pleasure from retention is happening. If the child fails to succeed this stage, that may result into the fixation. So the major conflict at this stage is toilet training. It is the utmost role or the important role of the parent to develop a good toilet training. And this positive toilet training will lead to a sense of accomplishment and independence. Instead of that, if the parental response is negative, if the parent is keep on scolding the child for not getting a successful toileting, the child may enter into the stage of fixation. Then cognitive development or the intellectual development. So two stages, sensory motor stage and pre-operational stage. And here you can see the picture of the brain of a child. Look at the inside brain of a child, how much thought process or thinking process he is having. So just pose a question inside your mind. Are we really bothered about all this thought process? Are we really taking care of all this thought process? So in cognitive development, tertiary circular reaction, the substages are the tertiary circular reaction and invention of new means and pre-operational stage. So the main, the child develops the object permanence. Object permanence is nothing but realizing that object exists even if they are out of sight. The child knows that if the mother is also out of sight, she may be hiding somewhere and she may try to identify the mother. Curious about the environment, and they start to explore the objects, gain comforts from the parent's voice, and they could able to imitate the sound of an animal, and to some extent they could able to imitate the adult behavior. But very rapidly we can shift the attention of the child. Pre-operational stage, the egocentrism, animism, and domestic mimicry is the special task they are attaining in the pre-operational stage. Already we have seen what is egocentrism. Then preoccupations with the symbols. They could, if they see one symbol, for example, if they see a wood piece, they represent it as a car. And still they are in the dream fantasy world. Memory increases and they could able to understand the past, present, and future. Even if they could understand the word tomorrow we will go to zoo means they will understand that thing. Then transductive in reasoning. That is, for example, transductive is nothing but it is difficulty to relate the cause and effect. For example, if a dog barks and immediately if a car is coming, the child may relate that whenever the dog barks, the car is also coming. So they don't know the exact relation between the cause and food. Or refuses food sometimes if a different color or a beetroot rice if the mother is serving, and for the first time the child may think that it is something different and child may not take that food. So transductive reasoning is developing over here. Always they'll go for the problem solving through trial and error method. Repeatedly they will do the activity. That is the meaning of the word circular reactions in the substages of the sensory motor. So till they get the answer, they will keep on repeat the actions. And domestic mimicry, it is nothing but imitating the parents' activities in the home. A boy will be imitating his father, or a girl will be imitating the household activities. The psychologist says that we have to involve in the domestic mimicry along with the child, and we have to encourage for doing the domestic mimicry. The moral development, according to Kohlberg, it is a pre-conventional morality stage. The two stages the toddler is undergoing, stage 0 and stage 1. Stage 0 is still to 2 years. The good is what the child like and want. Again, the egocentrism is working out here. Whatever the child like, if I like biryani, that I want it. If I don't like the vegetables, I don't want to keep that vegetables in that plate. This is the moral value of the child. Then coming to the age of 2 to 3 years, punishment and obedience oriented stage. If the child is punished for doing something, child think that it is wrong. If it not punished, it must be a right. So mother needs to be very cautious about whether she is punishing for a good deed or bad deed. It should not be wrongly interrupted. At the same time, if a child is doing a bad deed, we should not encourage the child. Many times, no, if the child is using a bad word, sometimes this toddler age, they use the word eda, vada, poda and all. So if we are encouraging for that, if we are laughing, if we are encouraging and if we are clapping the hands for that, child may think that what I am talking is correct. So it should not be. So wherever the punishment is required, a simple punishments can be given to the child. Spiritual development, it is intuitive, projective development. Still the child is in the world of fantasy. They could not able to relate the reality, but they imitate the religious behavior such as bowing the head while praying, but does not understand the meaning of that prayer. But still they could able to they could able to recollect the images of the God and goddesses and all. Then language development. So language is nothing but it is a code used by the child, and speech is the spoken form of the language. So how do children acquire language? By exploring their environment, by intensively exploring their sense organs, and by practicing through their ear. So this is the language development child acquires. You can see between the 1 to 3 year of age, first word is started, phrases they could able to bring, and sentences they could able to follow at the able to bring out at the end of the 3 year. Whereas in early infancy or early toddler stage and all, you can see the vocalization, just making cooing or cooing sounds, babbling, just they will say tata or something like that, dada, something like that way. And this is the phase the child is undergoing. Holophrastic phase is a one-word stage, and telegraphic stage is a two-word stage. But in telegraphic stage, what is the typical characteristics of the telegraphic stage is that only noun and verb is present. There is no connecting words between. You could see this picture. They may say baby draw or mummy, baby draw or mummy see, like that way. They do not able to connecting words is missing in the telegraphic stage. By 15th month, they could able to spell out 2 to 6 words, and even they could able to follow the meaning of no. 18 month 10 words, and maximum word by a 24-month-old child is 300 words. And even if we ask the question, show me your head, they could able to identify it. At the end of the 3 year, they may start to ask questions: what, why, what it is, or what is the reason for that, or so many curious questions they may keep on asking. So the work of the child, that is play. The typical type of play is parallel play. Parallel play is nothing but the child will sit together, but never ever they won't exchange their play items. This is the typical feature of play in the toddlers. Toddler inspect the toys and test its durability. Increased locomotive skill make appropriate for energetic toddler. So utmost care needs to be taken to select the age appropriate toys. That also safety measures needs to be followed. We know that the play is having different functions: physical development, social development, and all. So suggested physical development activities include: provide space in which the child should encourage the physical activity, and the suggested toys include push and pull toys, blocks, building blocks, or riding toys. Movable toys. Always the toddler boys likes to get a movable toys. For example, tractors, JCB, bus or car or something like that way. Social development: encourage the child to talk with adult tasks, encourage imitative play, and provide the toys and activities that allow for the expression of feeling. Even you can give a toy telephone, housekeeping toys, and something, a kitchen set and all, and you can make the child to encourage for the householding activities with the help of that toys. Mental development and creativity: to encourage the mental development, always read the stories appropriate to the age, and encourage building, drawing, and coloring books and all. Even you can give the crayons in the hand of the child, and you can encourage for the drawing. Then these are all the fun learning activities. This, even though it is a fun learning activities, it is stimulating the sensory organs, but ensure that all the fun learning activities needs to be done under the supervision. So next is the important area for the toddler: developmental task during toddler age. Toilet training. It is the very important area the parents needs to give utmost care. It is nothing but achieving control of the bodily function of defecation and urination, which is achieved between 18 to 24 months. This is the most difficult time both for the parent and for the child. How it can be identified? By identifying the physical readiness. So once the child is in the age of 18 to 24 months, the mother can prepare for the toilet training. Ability to stay dry for 2 hours, decreased number of wet diapers, walking dry from the nap. If the child is able to maintain irregular bowel movements, if the child is able to sit, walk, and in squatting position, and if she is able to remove the cloth or the fine motor development is actively developing, then that shows the physical readiness for the toilet training. Mental readiness includes: recognize the urge to defecate and urinate. The child may use his or her own language. Sometimes they may use the language like for passing urine, they may use shishikona or something like that. Verbal and non-verbal communication skills to indicate when net. Even they may touch the genital area Even they may show the hands towards to the bathroom. All these nonverbal cues needs to be identified by the mother. Instead of that, the parent should not scold the child. The parent readiness recognize the child's level of readiness and willing to invest the time required for toilet training. Psychological readiness include express the willingness to please the parents. They may go and hug the child. They may go and hug the parent. They may go and kiss the parent, something like that way. So this shows the psychological readiness. Able to sit in toilet for 5 to 10 minutes without showing any fussy behavior. Impatience with the soiled or wet diaper and desire to change that diaper immediately if it wets. So all this indicates the readiness, and these are the few tips for the parents for the successful toilet training. The parent has to understand the readiness for toileting. Age appropriate potty needs to be provided. Use the adult word for urine and bowel movement. Start by increasing the child awareness of the bodily function and always praise the child for each attempt, even if they are not totally successful. The praising can be in different form. You can give some toys in your hand. You can hug the child. You can reward the child. You can kiss the child. So this praising praising the child may fosters the autonomy, and the child may think that they have achieved something great. Never ever scold the child for accidents. Unknowingly, if the child has passed the urine or motion in the dress, don't scold the child. Practice session should be limited to 5 to 10 minutes. Never ever force the child to sit in the potty. Frequent reminder and trips to the toilet are very necessary. Even though the child is not giving the cues, you can take every hourly, you can take the child to the bathroom to go for the urination. Then these are the different types of potties available in the markets, and this may attract the child to sit in that potty, and this will ease the work of the mother. And the evidence shows that according to Sechkora et al. In 2020, the parent says that they didn't even started the toilet training between 24 and 36 months. That means even after 3 years also they haven't started. Older babies and toddlers may find it hard to break the diaper habit. Children learning to walk may be too excited to sit onto a potty chair. The Baroni et al. In 2009 identified that earlier training helps to protect the kids from developing bladder problem later in life. So the next important developmental task is sibling rivalry. It is nothing but it is a natural jealous towards to the younger sibling. Hope you remember this film, Malayalam film Ende Veeda Appundeyum, where that child character has shown a sibling rivalry and she has sprayed a pesticide onto the younger sibling. So this should not happen in any of the homes. So it doesn't mean that a child doesn't like the child. It is only a natural jealousy. What the child is not liking here is that she doesn't like the changes which is brought by the younger sibling, especially the separation from the mother. And how to identify the sibling rivalry? Irritability start to dislike the baby, hitching or pinching the newborn, drop the newborn if given it to hold, taking toys away from the newborn, keep on crying, and a regressive behavior. Regressive behavior in the sense they may step back to the previous development. Thumb sucking and demanding bottle, soiling the bed, toilet train the child. Again, they will go back to a regression using the baby talk. So all this shows the identification of sibling rivalry. And role of a parents in prevention of sibling rivalry, it should start from the antenatal period itself, include the toddler in the preparation for the birth of a sibling, and immediately once the identify that or help the toddler to identify the fetal movements. Even mother can ask the toddler to touch her womb and to identify the fetal movements. And once the mother has come back from the hospital, immediately she has to hug the elder sibling. And once she is comfortable, the mother herself has to take the elder sibling to show the younger sibling. Shifting the toddler to a different room, inform to the toddler that a new playmate will come soon. And along with that, even the mother can say to the toddler that you were also like this way in particular stage, and your younger brother or sister is not able to do his or her activities. She needs assistance from the parents, from the brother or sister, like that way. Provide a doll on which toddler can imitate the parental behavior, re-establish the band with the toddler's needs, and involve the toddler in sibling care. And even if any visitors also visits the new sibling, during the time we have to take care of this elder sibling. All the gifts or whatever the gifts the visitors are coming giving, it should be given to the elder sibling. The temper tantrum, it is another typical developmental task in toddler. It is not a behavior, it is a frustration towards to the autonomy. As the toddler strives for autonomy and confronted with many obstacles like imposed rules or demands, that they got an interference in their activity. So due to that, a frustration is built up and they are releasing their tension. So child doesn't know how to express their anxiety. The only way to express their anxiety and tension is temper tantrum. So understand this aspect. So temper tantrum behavior includes lying down on the floor, head rolling, head banging, and even breath holding. Guidelines to avoid temper tantrum: allow the child to make frequent small choices. You can give the choices. Do you like to wear the pant or trousers? Don't give a general choice. Which dress you like to wear, it is a general choice. But for example, do you like to wear a pant or a trouser? A two choices given. So if the choice is being given to the child may feel very proud in their mind. Oh, my mother is considering my feelings. To some extent, ignore the temper tantrum behavior. Avoid eye contact until the child has calmed, but ensure that the child is not hurting himself or others during this behavior. Move the obstacles out of the way or move the child during temper tantrum to avoid the injury. And deal the tantrum in a calm manner. The next is negativism, that is saying no to all the matters. So it's here is a verbatim by a mother. No matter what we tell him or ask him, our son has the same answer, no. It was funny at the beginning, but now it is training our patience. This is both a tough time for the parent and for the toddler. Whatever we say, they will say. Don't say bad words, they will say. Don't use like that way. Don't go towards to that area, they will say no. So negativism, again, it is not an expression of being stubborn or disrespectful. It is the no response to every request. The elder adults may think that the child is not showing a respectful behavior. It is not like that way. It is only the expression of their frustration. So again, we have to calm down the child. Regression, already we have seen the developmental regression. Child is going back to the previous stage. Signs of regression includes increased dependency, refusal to potty chair, temper tantrum, demand for bottle feeding, demand for crib, and loss of newly learned motor skills, thumb sucking, revert back to crawling. So all this regressive behavior, if the child is slowing, you have to identify that whether the child has encountered a major life changes. For example, the major life changes include threat to their autonomy, any repeated illness, hospitalization, and separation from the mother. And how to manage the regression: don't introduce the new areas of learning when an additional crisis is expected. If the child is sick, don't allow the child to go for the toilet training. Identify the problem and what is the stress that triggering the regression. Always give a positive reinforcement, that is in terms of hugging, kissing, or rewarding. Provide extra reassurance and attention and talk to your child. Ritualistic behavior is another developmental task, that is repetitive acts is being performed by the toddler to maintain success and stability in a confusing world. This is also to ensure that she develops the autonomy. Ambivalence, within same time they demonstrate love and hatred towards to the same person at same time. If I ask to a toddler, do you like me? They will say yes. The same time, do you like me? They may say no. So this is an ambivalence behavior. Curiosity, interested to know more on things, we have to be very cautious enough. Dawdling, slowness in doing the activities. Egocentrism, already we have discussed, whatever they see, whatever they hear, everything is belongs to them. It is mine, it is me, it is all about me. Then how to identify the abnormal growth and development in the toddler in terms of the social development. So normal we have seen, if the child is not making eye contact, if the child is not playing, pretending play, if the child doesn't copy the other's action, and if the child doesn't show interest in playing with others, it needs to be notified, because the autism spectrum disorders can start to develop at the age of the 3 years. So all this abnormal development needs to be notified by the primary caregivers or by the mother. If the child shows little or to no emotions, does not realize when unknown people are present, or she is not crying if she sees a stranger, does not show any signs of affection towards to the others, lack of emotion when a toy is taken by another child. The does not walk steadily, is able to throw or kick a ball, cannot copy a straight line or circle, and difficulty in balancing. And frequently, if the child falls even after the age of 3, it shows an abnormality in the physical development. Then abnormal development in relation to the cognitive intellectual aspect, lacks eye-hand coordination, unable to follow the simple instructions like no, does not gain the knowledge of body part shapes or numbers. So all this needs to be notified to roll out for the autistic spectrum disorders. Then how to take care of a toddler while doing the physical examination. As a pediatric nurse or as a pediatric student nurse, perform the examination in an appropriate non-threatening area. Ensure that the room is with toys, and provide all the frightening equipments needs to be kept out, and room should be well decorated with the neutral colors. That is the reason all the pediatric ward is set up with a wall with a Mickey Mouse, and a separate play area may be provided. Observe the behavior that signals the readiness to cooperate, makes eye contact, and accepting the offered equipments, allowing the physical touching. If a nurse, a pediatric nurse touches the child and the child is not making any reactions, it shows a positive sign. And child is giving the permission to sit onto the examination table rather than the parent's lap. If at all, if the sign is not observed, use the following technique. Make complimentary remarks about the child. You can say that you are a good boy. Your dress looks very nice. You look so cute on today. Tell a funny story or play a simple magic trick, and have a non-threatening, friendly environment by showing some puppets. These are the position, sequence, and the preparation during the physical examination. You can assume a sitting or standing position, or by the parents, or by making the child to sit in the parent's lap. So the sequence should be: inspect the body area through counting the fingers, use minimal physical contact initially, and introduce the equipment slowly. You can allow the parent to be in the physical examination room. Then, if uncooperative, perform the procedure quickly. Perform the traumatic procedures at the last. And if a restraints is needed, you can provide the restraints. And always don't forget to praise for the cooperative behavior. This is what many times the pediatric nurse may miss after doing the invasive or non-invasive procedures. Always reward the child. Maybe you can give some toy in the hand and praise the child for a cooperative behavior. And remember, never ever give a traumatic experience to the child. So reaction of a toddler towards hospitalization in the separation anxiety, 3 stages are coming: protest, despair, and denial. Protest in the sense they doesn't want to separate from the mother, so they cries loudly. So here the nurse can encourage rooming in and the parents can spend more time at the hospital. Despair, to some extent, they understand that they requires the hospitalization. My parent won't come back to the hospital again. They may cry intermittently. And the nursing interventions include encourage the family to talk with the parent and sibling and ensure that a consistency in the caregivers. Denial is nothing, the expected behavior that does not cry if the parent return and leave again. So encourage the child to play with other children in the unit. Physical harm or bodily injury, this can cause injury both to the child and to the pediatric nurse. They may kick, they may scream, they may pull away during the procedures, and even if we give a syrup, they may spit the syrup, and they may become upset while doing the procedures. So always be truthful while doing the procedure. Never say that it is not causing painful. Many times the nurse, while giving the injection, they may say that I'm going to give an injection, but it won't cause any pain. So don't say like that way. Be truthful to the child. Loss of control, that is the last stage. So the expected behavior is that they go back to the regression stage. So allow the child or allow to control when possible. The choices can be given to the child. If you're going to give an injection, you can ask the child in which hand I want to give the injection. So this will help the child to control their emotions. Then how to promote the optimal growth and development in relation to the nutrition. So this is another struggling area for the toddler mother. Parents decide what and when food is served, but children decide whether and how much. Establish a good eating habits. If a child is not getting adequate nutrient food, that results in undernutrition. 18 to 24-month toddlers are able to use their tongue to clean their lips, and they have strong need for independence and self-feeding, and this must be encouraged. Even if the food is spilled in the floor also, it doesn't matter. You encourage the child for the self-feeding. Grazing, that is nibbling and snacking. Nutritious snacking can be given frequently, and ritualism dictates the feeding practice. Ritualism is nothing for the feeding practice is nothing but the child may stick on with the same cup and same plate or same dishes or even sometimes the same dining table. So this is the daily requirement for a toddler. The calorie 1000 to 1400 calorie per day the child needs to get, and protein requirement is 13 gram. So the mother has to ensure that the child is being served in a colorful manner, the food in a colorful manner, and that also frequent small and frequent meals is liked by the toddler. The UNICEF report says that at least 1 in 3 under 5 children are undernourished or overweight. Another important area is dental care. At 6 months, the first visit to the dentist needs to be done. Early attention to the dental problem can prevent the loss, not only the loss of primary teeth, but the irregularities can be identified. Even they can start the brushing with the soft rounded bristles. Eliminate the bedtime bottle feeding, that is very important because these children are more prone to get the baby bottle tooth decay, that is BBTD. Then accidents, this is the important cause for the mortality and morbidity in the children. Due to their heightened curiosity and due to their gross motor and locomotive activities, the toddler are more prone to get the accidents. And this is the news article published in the last month in daily newspaper. Even a 2.5-year-old child consumed a tablet and she had suffered aspiration and died. And even the accidents through the balcony and all. And Statistics shows the reason for the drowning in relation to age, gender, and place of residence. The drowning while playing is more evidence in one between the age of 1 to 4 years. Drowning in girls are more evident, and drowning among the rural children are more evident while playing. And in relation to the burns, the age group of 1 to 3 years are more prone to get the scalds and contact burns, flames, and electric burns. So all these incidents give an alarming report, and the mother needs to be utmost care to protect from all this hazardous area. So use no hanging tables or clothes or runners to prevent the burns and scalds. Use the plastic plugs or tape over the unused sockets to prevent from the electric shock. Never leave the full tub unguarded, or never leave the child alone to the bathroom to prevent the drowning. Lock the doors of the car to prevent the accidents in the car, and always keep the small objects, especially the small objects like safety pins, buttons, away from the child to prevent the aspiration of the foreign body. And make sure that whatever the toys we are giving, especially the whistles and all, should not be given to the hand. Balloon, pieces of balloon, whistles and all. Ingestion of the lead is the another accidental area. So defective walls of the room needs to be carried out properly, and appropriate durable play items needs to be provided to the child. In order to prevent the infectious disease, in the age of 15 month and 1.5 year and 18 month, the mother has to ensure that all this vaccine has been taken by the child. MMR, measles, mumps, rubella, varicella to prevent the chickenpox, DPT first booster dose, and hepatitis A second booster dose. All these vaccines needs to be in the appropriate age and ensure that child is not getting a threat, traumatic experience. Then in relation to clothing, clothing should be very comfortable. It should not be too tight and too loose to restrict the movement. A 12 hours of rest and sleep is very essential for the child, and always set a bedtime ritual or routine. Toddlers, many times because of their increased activities, they likely to resist the rest and sleep. Sensory stimulation activities needs to be encouraged. For example, if you give an orange in their hand, let them, we peel and give the orange in their hand. They learn that when peeled orange, they are round in nature and they are wetty or juicy in nature. So sensory activities needs to be stimulated. Language activities. Adults should teach different sounds to toddler, the sound of an animal, but it should not talk beneath their child's level. If the child says that my shoes, the parent has to correct it. Yes, these are your shoes. Make sure to read out the stories and talk to them often. Love and security, hard punishments should not be given. They feel bad. Parents should not call the children, you are a bad boy, you are a selfish, you are a naughty boy. Understand the toddler's emotions always. Discipline is the another important area we have to insist on to the child, but it should be in consistency. It should immediacy should be followed, and firmness needs to be given in the constructive discipline. Unnecessarily don't give the punishment to the child, especially the physical punishment and all. Timeout is the very best method. What is this timeout? It is nothing but you can make the child to sit in a separate room where they are not getting any stimulative activities. So due to boredom, the child may think that this is the punishment for my activity, and ignoring that activity to some extent or explaining what the child did and why what the child did, and that activity is a wrong activity. But never ever do the physical punishment. Even though we are at the same time, we have to encourage the independence, that is autonomy. Then what are the parental guidance? It is divided into 3 ages. Prepare the parents for the expected behavioral changes of toddler, especially negativism, because the parents also may have the confusion in their mind. Assess the feeding habits and gradually wean off from the bottle. Potential dangers of the home needs to be identified by the parents. Discuss the need for firm but a gentle discipline and negativism and temper tantrum. And coming to the age of the 1.5 year, stress the importance of peer companion in play. Explore the need for preparation for additional sibling. Discuss the signs of readiness for toileting. We have already seen different types of readiness. Prepare the parents for signs of regression in time of stress. The parents needs to identify that if the child has gone back to the thumb sucking behavior, it is a sign of regression. Then in later toddlerhood, discuss the importance of imitation and domestic mimicry. That is very important for the social development. Discuss approaches towards to the toilet training. Stress the uniqueness of the thought process. All the toddlers are unique. Even though the GND is occurs in a predictable manner, the uniqueness we could able to see in each child. Discuss the investigations of preschool or daycare center, because the child is getting ready to enter into the preschool stage where the parent has to identify a good preschool or daycare center. So this needs to be taken care by the parents, and even a pediatric nurse or a student nurse can taught regarding the preparation about to the parents related to the toddler care. And possible nursing diagnosis due to the increased locomotion and accidents, risk for injury related to curiosity, imbalanced nutrition less than body requirement, delayed growth and development related to motor, cognitive, language, or psychosocial concerns, risk for disproportionate growth related to late bottle weaning, interrupted family process related to issues with the toddler development, hospitalization or situational crisis, readiness for enhanced parenting related to potential desire for increased skills. So these are all the possible nursing diagnosis for a normal growth and toddler with a normal growth and development. So to conclude my talk, this is an appeal from a toddler. I am a toddler. I am not built to sit still. Keep my hands to myself. Take turns. Be patient. Stand in line or keep quiet. I need motion. I need novelty. And I need to engage the world with my whole body. Let me play. Trust me. I am learning. So this is the appeal from a toddler. Being the caregivers, being the primary caregivers, being a pediatric nurse, being a pediatric student nurse, we have to understand this appeal and we have to provide an optimal growth and development for the toddler. So that's all. Thank you for your patient listening.
Thank you, ma'am. She has well explained about general characteristics, physical or biological growth, system-wise development, motor development, psychosocial, psychosexual, cognitive, moral, spiritual, and language development, play, developmental tasks, as well as normal and abnormal growth and development of toddler. Grateful to you, ma'am, for fantastic session. Dear delegates, it's time for question answer session. You can clear the doubts if any. Anybody have any doubt, you can raise your questions.
Ms. Surya, did you find any questions in the chat box?
No, sir, not at.
Yeah. So we are just going beyond the time limit. Any questions from the participant? It's time for us to wind up. Anyway, I would like to thank Dr. Nandini for her wonderful presentation for last 1 hour. I'm sure that this is going to be a real ingredient take-home message for all the nurses and nursing students and for all the faculty members who have been over here for this participating in this webinar. And being in Lourdes College of Nursing, we are taking the great advantage of this pandemic into an opportunity. And we are not only trying our level best to doing in our academics within our 4 walls, but also we are trying to reach to the every institutions across in Kerala. That was very successful today, even including yesterday also. Today, I would see there are around nearly 500 participants through Zoom and around nearly 200 participants through the YouTube channel. We would able to bring 700 participants, delegates under one umbrella for this webinar series on the day 2nd, actually. So this is a great success, and our strength is your participation. I'm sure that this is going to be really making a different line of dealing online teaching, which is going on already in Kerala. I'm sure that we are adding up a great pattern to this kind of series in Kerala. Thank you very much for all your participation. And I would like to share one more moment which was happened during the session. There was a big scribbling going on. We were really, in an apprehension situation. But when we identified that one of the mother participant, she given a mobile to one of the toddler, he started scribbling onto the screen, actually. That is what has happened. Okay, so that's the thing. It was going on anyway, but it's fine. Right. Thank you very much. Mrs. Surya, please move on to the next.
Okay, so really the toddler has started the job, Sunday.
Yes, that's true. Yeah. And all the participants, my kind request is we have another 3 more days of session with different personalities, and you are more and more encouraged to being a part of us for to achieving big things during this COVID-19 pandemic. Thank you once again for all of you. Thank you, Nandini.
Thank you.
Ms. Surya, please go on.
As we express our gratitude, we must never forget that the highest appreciation is not to utter words but to live by them. Now I invite Mr. Sriraj Aran, HOD Childhood Nursing, Lourdes College of Nursing, Taliparamba, to deliver the vote of thanks. Over to you, sir.
Good afternoon all. It's given me an immense pleasure to deliver the vote of thanks for our auspicious occasion. Let me first of all thank Lord Almighty for making today's session as great success. I take opportunity to thank Professor Dr. Nandini M., Vice Principal, Ashwini College of Nursing. I appreciate and congratulate your wonderful session about growth and development of toddler. And we thankful to you for your time and effort made towards making it memorable one. Your lecture was impressive and would certainly benefit all of us from the breadth of knowledge and depth of expertise. Thank you, Madam, for your valuable lecture, which helped us to improve our knowledge about the topic. Now, I would like to thank our dear Principal, Professor Senthil Kumar T., who is the source of inspiration and motivation for each one of us to conduct this webinar, which is very useful to help for everyone of the use of our students and those who attended this session. Thank you, sir, for your timely support, care, concern for each one of us to make this day a successful one. Now, I thank our Vice Principal, Mr. Johnson LK, for his unparalleled support for this webinar. Thank you, sir.
Thank you, Sriraj.
My heartfelt thanks to all our HODs of various departments and the faculty for their valuable contribution, guidance, and encouragement in all our efforts. Now, I would like to thank all the students and all those who participated in the webinar. It is an audience like you that makes made the presentation very awesome. Thank you very much for your unwavering attention throughout the webinar. Once again, thank you one and all.
Thank you, sir. I'm sure all of us definitely had a wonderful session. And it's a great honor to be part of for making such a wonderful events for the best interest of students' welfare. We are expecting same enthusiasm and active participation for coming session of our webinar series too. Thanks and regards from Lourdes College of Nursing. Once again, thank you. Thank you.
So all of you invited to join on the same time at 11:15 tomorrow also. And thank you. Let us leave the meeting.